Good morning, everyone. Sorry for not broadcasting yesterday as promised. Even this morning, there are still forces that want to prevent this broadcast from coming to reality. So, but I'll try my best and I'll quickly run through it before those forces succeed. So, we'll talk about management of viral diseases. Though that topic looks very, should I call it, it's not just viral diseases that we'll be talking about generally, but management of diseases. I only use viral diseases because that's the angle I'm always talking from. So we can use this, whatever it is I'm going to talk about in this topic, to also in relation to other diseases as well. So welcome to Microbiotics BioTalk, the Miniseries. How do we manage viral infections? How do we manage infections generally? Well, there are three broad interconnected ways and strategies that we can use. Of course, before a disease establishes itself, you have to kind of try to prevent it. And this is usually the first step, try to prevent, so that you won't get into that disease state. If you are already infected or if you already get disease, the next step is to diagnose accurately. People need to know exactly what is wrong. It's a dangerous thing when you don't actually know what is wrong with you and you go ahead and you do the next one, that's treatment. So diagnosis, the correct diagnosis must be made. The causative agent must be identified. The actual disease, the actual illness must be known before you decide to now do the third step, that's treatment. Treatment is usually a whole different, a large covered, a large area on its own. So all these three methods, all these three strategies, we're going to talk about it, but we're going to first take them one after the other. So, and okay, like I said, they're applicable to other diseases. And under each strategy, there are other sub-strategies. So we'll be taking a strategy at a time and we'll be considering it. So let's start with prevention strategy. One of the ways to manage and control diseases is to first prevent it. And in fact, there's this old saying that prevention is better than cure, and it's I think they still hold true up to now. If you look around us, in fact, all of us actively do that. We try to stop a disease from establishing, so that we won't need to treat it. Though most of the time our attempt usually fails because prevention of a disease is not just a single approach, and no matter how much we try, sometimes we still fail. So that's the reason why you buy mosquito nets. That's the reason why you decide not to take some drinks. That's the reason why you prevent fluid transfer. There's so many ways in which you can prevent diseases from getting established. So we'll look at all the strategies, all the sub-strategies, and we'll see the information contained there. So now, for you to prevent a disease, you need to actually know the stages of diseases that you have. You need to know whether the disease you have, the condition you have is an underlying condition, it's an underlying disease. Maybe that disease state is underlying. Maybe you're susceptible to it. Maybe it's a subclinical, maybe it's a clinical one, or you are at the recovery stage. Underlying condition, of course, those are the diseases that most of the time are always there, and that they are chronic diseases that we manage for a long time. Example is maybe diabetes, hypertension, chronic heart diseases, all those diseases that are being managed. They are chronic, they are there. You're managing them almost every time. Those ones are underlining. So the way to prevent that, the way to prevent that is different from others. And also we have the susceptible one. Susceptible, if you're susceptible to a disease, it might be because of your genetic makeup, or it might be because of the environment you live in. So that's another example of a stage of a disease. Then we have the subclinical. The subclinical are the ones that doesn't show any symptoms or sign. Even though you already have the disease, you already have the example is HIV and even hepatitis. You don't show the symptoms, but the disease is already there. It doesn't show any signs, it doesn't show any symptoms. The clinical ones are the one, of course, that are very visible to see. Very visible to see. Most of the time, the subclinical also become the clinical eventually by displaying the signs and symptoms. And the last aspect is the recovery stage, or maybe it gets worse, become a disability, or maybe it finally gets worse and it becomes death. So those are the different stages of diseases in the natural history of a disease. So based on this disease classification into stages, the preventive measures being associated with each are different from one another. They can also be interconnected, but the stages determines the way the disease is being prevented. And based on that, we look at these four different there's actually 5 different methods. There are primordial, primary, secondary, and tertiary, and then we have quaternary. We'll go through all those ones. So the bullet says combined together, these strategies not only aim to prevent the onset of disease through risk reduction, but also downstream complication of a manifested disease. As we go along, we're going to see more of that. So let's start with primordial prevention strategy. Now, this kind of prevention strategy is aimed at controlling the spread of a disease in a large population, and you don't go through it the way you go through others. You try to focus on the social and environmental factors in doing this, and one of the ways to do that has been listed here, because it's a through laws and national policy. Of course, it targets the underlying stage of natural diseases by targeting the underlying social conditions that promote this disease onset. The examples here are government increasing taxes on cigarettes and decreasing advertisements of tobacco. And then also provide access to safe walking paths, access to stores with healthy food options. I remember there was let's quickly relate it to Nigeria. There was a time when Dangote and I've forgotten the other, is it UAP or BUA? Yeah, BUA, they were talking about sugar production. And sugar production, the capacity that Nigeria could. And I remember Dangote group of companies dragging BAU to court and saying that I was stuck with a particular statement in one of those their facts. They said that there's a limit of sugar that should be in circulation in the country at a point in time, and that they are already producing that quantity. So BAU cannot attempt to produce. Of course, that got me thinking, and when I made the research, I realized that there's actually a policy concerning that. There is a limit of sugar that should be in circulation in the country at a particular point. I know that sugar is actually consumption of sugar is actually one of the biggest factor in the should I call it in the stages of diabetes. So consumption of sugar, consumption of salt. There are some policy that only government could institute to reduce the occurrence of some diseases. so that by the time these policies, these laws are put in place, of course, if you look at, I think I also read somewhere this morning about the fact that the cost of cigarettes in Australia is about $35, 35 or $30. I think 40. I can't remember precisely. I think it's $40. So, and because of that, a lot of people don't buy them. Of course, it's expensive. So, before you can get a pack of cigarettes for $40, I guess, well, you must be really desperate, and even once, if you sold it just once, it may take you some time to also purchase it. So this is a primordial prevention strategy targeted at the onset, the source of one of the factors causing a disease, and in most countries it works perfectly. In fact, they work perfectly. So it is a way of preventing some diseases. So we'll go to the next one. Now, the primary prevention strategy consists of measures aimed at susceptible population or individuals. Don't forget that the primordial is targeted at underlying diseases. This is targeted at susceptible population, those who are prone to have a particular disease. The purpose is to prevent disease from ever occurring. And the stuff about primary prevention is that it's the regular, it's the common prevention strategy that we are all aware of, the one we can carry out ourselves when we are not sick. Of course, its target is usually the population, those of us who are healthy. If you look at the examples there, immunization. Yes, immunization is a primary prevention strategy. The amount of immunization, vaccination we took when we were young was targeted at we never having some of these diseases, and up to now some of us don't even have it. The MMR that we took when we were young prevent mumps, measles, and rubella, so some of us are safe and sound from that. The current vaccination going on for COVID is to prevent not having the full-blown disease. So you buying, yes, I made mention of one at the earlier stage. I said buying of mosquito nets. Yes, that's a prevention strategy, a primary prevention strategy. You don't want to have malaria. You don't want to get any infection that mosquito transmit. So the examples of the other examples of this, including tobacco cessation program, where you completely shut down tobacco production. The needle exchange program. This needle exchange program is actually, when I read up on it, it was very controversial. I know it's usually, I think it's done in the US. They provide needles for those who inject themselves. So they were like, if you are going to inject yourself, at least get a good needle. So the program is at loggerhead with their law enforcement issue concerning drug usage. So you can imagine that. But this is actually what they are targeting. They are targeting the fact that you can prevent some blood transmitted diseases that usually occur through needle, like HIV. So they want to prevent that, but well, the other side of it is a little bit confusing. But that's basically about primary prevention strategy. They said it's commonly institute activity that limits risk exposure, and increase the immunity of individual at risk to prevent the disease from progressing to a susceptible individual to a subclinical disease. So most of what we practice around here, personally, they are also, should I call it, primary prevention strategy. Your refusal to buy a particular product, to take a particular food substances, when you know that, okay, it's going to get you. In fact, there's another one that I think we commonly do. I don't know if I can call that a primary prevention strategy, but it's actually a good example. If you are your blood genotype is AS, and you refusing to marry or to have child or to have children with another AS individual, you are preventing a particular disease from occurring. You're preventing one of your offspring from being a sickle cell patient. So that's another way you can look at it. So now let's go to secondary prevention strategy. This is a little bit different from the rest. In secondary prevention strategy, the emphasis is on early disease detection, and the targets are early appearing individuals with subclinical form of the disease. Now, this is one of the most interesting part of disease prevention, because we just had a lecture recently towards this area. If you remember, we spoke about HPV, human papillomavirus, the cause of cervical cancer, and we mentioned that this thing will have been in the body for a long time. It will have been appearing before it now reaches the stage of cervical cancer. It will appear as what? It will appear as the lining of the vagina, the vulva might have appearances of what before getting to that cancerous stage. So here is, in fact, another example here is another topic we'll be discussing very soon, that we're going to bring Dr. Fanny here to discuss. That's hepatitis B. Hepatitis B also have a way in which secondary prevention strategy can be applied to it. Most of the time, the common test being done for HBV is to check for the proteins, those antigens, antigen E's and the likes. Now, at that stage, it has already become clinical, or even more or less clinical already, but I don't want to say subclinical, because if you check the blood of that patient before the antigen gets released, you will have seen the HBV DNA. We call that an HBV DNA test. So it will appear as if you are healthy, but you are not healthy. You are not healthy. It hasn't reached the clinical stage. It's still at the subclinical. The disease is already present within you. And even though you appear okay, you are not. So before you get to the clinical stage, you now decide to prevent it. Yeah, that's what secondary prevention strategy is about. Look at the example that I listed there. I've already talked about a pap test, pap smear test for the detection of cervical cancer, or even the human papillomavirus DNA test, HPV DNA test. You check for the DNA test. The moment you see traces of it, or you see the cell lining are having issues, the lining of the vagina, the internal organs are having issues, you quickly move ahead to treat it. Then, of course, one of the examples also is mammography in the detection of breast cancer. Before you get to the breast cancer, before you get to the tumor stage, you quickly detect so that you move into treatment. Then we have colonoscopy. Then you have blood pressure screening for those with hypertensive tendencies. So this is what secondary prevention strategy is about: detecting the subclinical signs before it gets clinical, before it gets to the full-blown state of signs and symptoms and the likes. So, okay, then tertiary prevention strategy. Now, this targets both the clinical pattern, the clinical part of the disease. It is implemented in symptomatic patients, and its target is to reduce the severity of the disease, as well as any associated factors that may join it. So now, why it is mentioned that why secondary prevention seeks to prevent the onset of the illness, the onset of the full-blown illness. Tertiary is to reduce the effects of the disease once it is established in individuals. So this is more or less like management of the disease state. so that it won't go beyond what it already is. If somebody already discovered that it's hypertensive, yeah, you already discovered, you checked, and it's discovered that you have hypertension, you quickly you start taking drugs. Of course, this involves treatments. Anyway, it's involved treatments. It's not just prevention. Yeah, it's also a prevention strategy, because this prevention strategy will, in most cases, stop the disease from progressing to critical stages like death. So, of course, we've given examples here. Occupational and physical therapy for prone patients, cardiac rehab for post-myocardial infarction patients, and the likes. And okay, I'll give a common example here. HIV, for the moment, it's already become a clinical state, a clinical disease. You can see the outcomes. Then the target now will be to reduce the viral load. You keep giving them what's it called, antiretroviral drugs, and you keep checking monthly whether there is a reduction in the viral load of the patient. Also, hepatitis B, once it is established that this person has hepatitis B with the symptoms showing, you keep treating, give a lot of drug, and keep checking if the stages of the disease is reducing and is not progressing to the terrible stage of liver cirrhosis and the likes. So that's tertiary prevention strategy. And lastly, the quaternary prevention strategy. Now, this is not, how can I call this? This is not really for the patient. Yeah, it's for the patient, but it's targeted towards the caregiver, the medical personnel in charge of the patient. As you can see, they said quaternary prevention is an action taken to identify patients at risk of over-medicalization, to protect him or her from new medical innovations, and to suggest to him intervention which are ethically acceptable. Now, this topic, I think maybe I'll find the time to actually talk more about it, because this is actually a major issue, and it's a very sensitive issue. It's a sensitive issue. I experienced some of it firsthand in my time at UCH. Sometimes when a patient reaches a critical level, the medical personnel will just try to, should I call it, go overboard with the treatment. They recommend all sorts of drugs, even some that are extremely toxic to the patient, aggravating the symptoms in some instances, and that's why I said it's sensitive. Some of these patients, sometimes they agree to it. In fact, there is in what they call this clinical trial of a drug, most of the participants who are given informed consent about, who gave their informed consent in participating in the study, are given drugs that are not at the stage of testing. So it's a sensitive topic, and I will get to talk about it very, very, very much later. But if you look through the list of examples, you'll be able to get a lot of examples of what I'm talking about.